Reflection by Jaime C. Riches, D.O. If I stand this way, with my shoulders back, my chin lifted, if I hold my breath for a moment, my skin fits my bones just right. Every subtle motion is an effort to make my clavicle more prominent, to manifest my ribs. I feel so ignorant about beauty. I was at the side of her hospital bed as she uncovered herself and asked me to look away. Her eyes, glassy and hollow, met mine. I'm so ugly right now. It's an interesting piece of practicing medicine to be an observer of bodies, their look, their feel, and their function. Which lines are strength and which are fatigue? Which ones are scars and how they have healed? My words were soft and aching. "You are beautiful," I said, knowing that her skin fits her bones too tight. They are almost all that's left. My 38-year-old cousin's oncologist is my colleague, my friend. When she was diagnosed, he reminded me that there were excellent treatments available. I reminded him that none of them would allow her to see her children start kindergarten. Redefining excellence, I thought, sounded like a cancer center's marketing strategy that just missed the mark. As I looked away, a piece of me splintered. It isn't the same when it's someone you know, when it's someone you love. Maybe I feel shame for underappreciating my own fertile marrow, my fat and muscle, and my own existence. Maybe it's guilt for dedicating my whole life to work that can't save her, for being the one to look her mother in the eye and say she can't be saved. Maybe just sadness. This lonely world that only exists right at the bedside is like a magically devastating song, and I am humming the rhythmic asynchrony of being a doctor and just being. From where do we yearn, I wonder? It's from within these little spaces we look to fill the absence of something beautiful, the moments that we're longing to be a part of. We are all mothers, the 7 of us now in her room, aunts and cousins united by a last name, by the successes and losses we previously thought unimaginable. We've known the brittle anticipation of a new life, the longing, the joy of spending time, and the sense of simply existing in these spaces. We are the daughters and sisters of firefighters. We are women who know the low bellow of the bagpipes, women who own funeral clothes. We've tried to disinherit the same shades of blue, and all of our distance has brought us right here, with her making her comfortable. She knows that her time has been spent. Her eyes are the color of her favorite flower, a yellow rose, and her once sterile room appears almost sunlight by the garden of bouquets. Her mother is sitting by her side, gently moving her fingers across what would be a hairline, the way you would touch a newborn in those moments when you're just realizing you didn't know you could love someone so much. There's a song running through my head, Golden Slumbers, The Beatles, Abbey Road, 1969. Even playing in my memory, it gives me chills, starting right beneath my jaw and circulating through my limbs. Once there was a way to get back homeward. Once there was a way to get back home. Sleep, pretty darling, do not cry, and I will sing a lullaby. Nothing illustrates the frailty of existence like a mother preparing for her inevitable goodbye. Once you see it, you can be certain that biology isn't perfect. We're convinced that we're grieving throughout the whole of motherhood, as our babies become grown people of their own, as they live their lives. But it isn't grief. We're simply living a life that is singular, in a series of moments that are final. Golden Slumbers doesn't actually seem to end. It just subtly transforms into the next track as if they were one, and before the chills are fully absorbed, you're struck by something totally new, triumphant trumpets. When her breath stopped, it wasn't held. I don't think she realized the bravery it took to leave this world with such grace, to be unlonely. I've been witness to so many punctured, pulseless yawns, but not this one. I wish I knew by which of these wounds I am softened and by which I am hardened, but I don't. They heal with secondary intention, naturally and slowly, from the inside out.
Welcome back to JCO's Cancer Stories, The Art of Oncology. This ASCO podcast features intimate narratives and perspectives from authors exploring their experiences in oncology. I'm your host, Mikkael Sekeres, I'm professor of medicine and chief of the Division of Hematology at the Sylvester Comprehensive Cancer Center, University of Miami. Today, I am so thrilled to be joined by Jaime Riches, who's assistant professor at Columbia University and director of the Hematology Oncology Hospitalist Service. We'll be discussing her absolutely gorgeous article, Reflection. At the time of this recording, our guest has no disclosures. Jaime, I want to thank you so much for contributing your essay to the Journal of Clinical Oncology and welcome you to discuss your article.
Thank you so much for having me.
I have to say, I was so moved by this and just loved the writing. I don't drop the G word gorgeous very often when describing pieces, but this was truly moving and truly lovely.
Thank you. Thank you so much. It was a really deeply personal story to me.
So I wonder if you can tell us a little bit about yourself. Where are you from and walk us through your career? For example, where did you do your training?
Well, I am from Brooklyn, New York, and I did my training at an osteopathic medical school in Harlem called Toro, and my residency training at what used to be called St. Luke's and Roosevelt and now is Mount Sinai West after many of the New York City mergers. I did a chief resident year at Memorial Sloan Kettering and started my oncology hospitalist career there for many years and have been at Columbia now for 3 years.
Wonderful. Isn't it interesting how the institutions of our youth are no longer, and that seems to happen at a faster and faster pace?
I know I feel the need to reference the old name sometimes when I'm discussing.
Can you tell us a little bit about your own story as a writer? How long have you been writing reflective or narrative pieces?
I have probably always been a jotter. I think that's for as long as I can remember, and I've enjoyed that process. And I think once I was an undergrad, I studied chemistry, I majored in chemistry, but I really filled up a bunch of elective time with writing classes and learning what I could about the processes of writing. And I guess almost 10 years ago now, I enrolled in the graduate certificate program in narrative medicine at Columbia. And that program helped me explore a little bit in terms of form and function and in terms of really relating my writing to my own personal experience as a physician.
And if I'm not mistaken, the field of narrative medicine was really in part born at Columbia, wasn't it?
It was, yeah. Rita Sharon was the founder of the practice as a field, yeah.
And what was it that experience, what did the formal training teach you that you couldn't have figured out on your own by the iterative process of reading and writing?
I think there's something to having a group of people critiquing you that really allows you to become better in any field, in any practice. And I think there's something to having, a relatively safe space to explore different ways of doing something. For example, writing poetry, which I really hadn't done much of before and have done a bit of since. I think having a space where there are both educated critics and experts being able to look at your work and say, this is working and this isn't, was really helpful for me.
I've heard with writing the notion that your first critic should be people you trust and feel as if you're in a safe space with because you're so vulnerable with writing, even exposing it to relative strangers in a formal course can be, I don't want to use the word damaging, but I guess damaging, or at least get you out of a safe space that you need for writing. Do you have an inner circle that you trust for your writing?
I do.
If you feel comfortable doing so, can you tell us what prompted you to write this piece?
This piece just sort of came out. This piece is real and it's a real experience. And the processing of this experience has happened on so many different planes for me. And writing is really one of them. And once I sat down and said, let me write some of this down, it just kind of poured out.
sometimes we write to process. I once heard somebody say that writing is the only time in life when you get a free redo, right? Or a do-over. We say something or we post something on social and it's out there in the universe. But with writing, it's very personal. And we can look at a paragraph or a sentence and say, gee, that just doesn't feel right, and rework it. It's not communicating exactly what I was hoping it would. The other aspect of writing, of course, is that it allows us to ruminate on something that's just occurred and to try to make sense of it. Do you think that was some basis for writing this?
I think so. And I think maybe just relating one really specific experience into the greater realm of the work that we do every day, and how that experience both stood on its own, but also is woven into so many other patient encounters and encounters with families. And that's a form of processing, I think, for sure.
Can you tell us in your own words about the main character in this piece and what was going on? Because you write it in a lovely way that allows the reader to discover what's transpiring gradually. But if you could tell us in your own words, who is this person?
Yeah, so the person that I'm talking to in some parts of the story and talking about in much of the story is my cousin, Patrice, who was diagnosed with bladder cancer at 38 years old, and who has had interactions with the medical field as a patient, but is not a physician, is not a medical professional, and so had a lot of questions and a lot of trust and reliance on those of us in the family who had some medical knowledge and experience. And so I wound up being pretty intimately involved in her care as a family member. And that was really a fine line in a lot of ways, because my friends and colleagues were the care team and I was the family member, and that many of us have been in that position in many different ways, but it's always a fine line. And she was young and she was very positive throughout really the course of her illness. She had twins who were 2 years old at the time of her diagnosis. And I think I'm a little bit speechless now, as you can see. I think she just was so incredibly graceful. And I think I used this word in the story throughout the entirety of her illness, which included multiple lengthy hospitalizations where she had spent time away from her children. And I still don't know how she did it, with the patience and the thoughtfulness and the love for everyone else that she did.
You really honor her in this piece and paint such a beautiful portrait of her. In the essay you write, it's an interesting piece of practicing medicine to be an observer of bodies, their look, their feel, their function. Which lines are strength and which are fatigue, which ones are scars and how they've healed. It's a beautiful couple of sentences. In this case, you aren't really playing the role of doctor, are you? Can you talk a little bit more about when that line's blurred between being a family member and the practice of medicine, when people are relying on you to help out with their medical care?
Yeah, I think most of us know this gray area fairly well. And the gravity of the situation really dictates how blurry the line is. And it's true, I wasn't the doctor in this situation, and I had as much information about the scans and the clinical picture and the day-to-day trajectory and the lab results and the toxicity profiles and the data from the studies that the regimens were approved based on. And that made it impossible to step out of the doctor role or mentality. And I also wasn't making the formal recommendations by any means, but I think it's hard to sort of exempt yourself from that space once you're in it.
Yeah, I think we also sometimes don't realize how even the smallest contribution we have in advising somebody about their medical care becomes very, very meaningful, and how much those words can have an effect on somebody. I recall my uncle was diagnosed with acute leukemia, so that's right in my bailiwick, of course. And I remember talking with him about transplant and being as neutral as humanly possible about whether he should proceed with the transplant given the characteristics of his leukemia. And months later, after he had gone through the transplant, he said, I went through this even though you really advised me not to. So as neutral and trying not to sway someone and giving advice as we are, people hear us differently. Did you find that also with your cousin?
I did. I phoned into one of her oncologist appointments, and her oncologist, who I have to say is wonderful and who I have the utmost respect and really love for, who took great care in taking care of her, went through in detail everything they could about her disease and about treatment options and really explained everything and took a minute and said, okay, do you have any questions? And my cousin said, no, whatever Jaime thinks. They said, okay, well, we'll chat a little bit later. But that made me realize, which I think I just hadn't before, how much having an opinion matters.
Yeah, and that it's a gift to people when they can cede some of that decision-making or some of that knowledge to somebody else and feel as if they don't have to take it on themselves.
Yeah.
I want to read one other quote from your piece. I could actually just reread the whole piece. I enjoyed it so much and keep quoting it. You write, "We've known the brittle anticipation of a new life, the longing, the joy of spending time, the sense of simply existing in these spaces. We are the daughters and sisters of firefighters. We are women who know the low bellow of the bagpipes, women who own funeral clothes." There's a lot that swims beneath the surface, I think, in that quote. That family members get together at births and deaths, that these become the occasions for the family to get together, that we put on uniforms for them and that they happen frequently enough that we actually own the uniform to be part of them. Is that what defines us as families? Is that what we've come to? Or how about as physicians? We own uniforms as physicians also. Are the gatherings, the only gatherings we have with our colleagues at tumor boards when we discuss successes and failures of our patients?
That's a great question and a great reading. And thank you for these questions. I think every family is different, obviously, and I won't speak for the masses here, but there is a bit of a structure to the events that you're expected to attend and that you're expected to not be absent for, to sort of show up for. And those events are sort of, you're right, births and funerals and weddings, and they have a bit of a code to them. And as physicians, it's interesting to think about things like tumor board as the gathering spaces, because although as colleagues, we're not families, we are the closest thing to going through some of these moments together. And I think these moments at the bedside, and I use that term so often because I work in the hospital and I am literally often sitting in a hospital bed, holding someone's hand, talking to them. Those are the moments that we feel. We feel them in our bodies. I can feel it right here and touching my chest when I say that. I don't get that same visceral feeling from looking at most scans, looking at most lab reports, or even having academic conversations with people. And I think that you're right. Things like tumor board or even other academic conferences really are the gathering spaces for physicians. But that makes me question if those are the spaces that matter most.
I think that's a great point also to end our time together. It has been such a true pleasure to have Jaime Riches on our JCO Cancer Stories podcast to talk about her gorgeous piece, Reflection. Dr. Riches is assistant professor at Columbia University and director of the Hematology Oncology Hospitalist Service. Thank you so much again for submitting your piece to us.
Thank you so much.
And thank you to our listeners for choosing JCO Cancer Stories, The Art of Oncology. If you've enjoyed this episode, consider sharing it with a friend or colleague, or leave us a review. Your feedback and support helps us continue to have these important conversations. If you're looking for more episodes in context, follow our show on Apple, Spotify, or wherever you listen and explore more from ASCO at asco.org/podcasts. Until next time, This has been Mikkael Sekeres.
The purpose of this podcast is to educate and to inform. This is not a substitute for professional medical care and is not intended for use in the diagnosis or treatment of individual conditions. Guests on this podcast express their own opinions, experience, and conclusions. Guest statements on the podcast do not express the opinions of ASCO. The mention of any product, service, organization, activity, or therapy should not be construed as an ASCO endorsement.